Okay, hello to all. This work is about the effects of smoking on carotid arteries, structures, and hemodynamics, role of the radiographer in ultrasound assessment. So, tobacco is a behavior associated with the appearance of several pathologies such as atherosclerosis or strokes. The American College of Cardiology Foundation and American Heart Association, in collaboration with other institutions, developed guidelines where it is advised to perform ultrasounds Doppler in asymptomatic patients with no or suspected carotid stenosis. It is crucial that those alterations can be evaluated to prevent major complications to the smokers' population. Qualified radiographers in sonography field should be able to detect premature vascular changes due to smoking. So the purpose of this study was to assess and compare structural and hemodynamic parameters on carotid arteries in smokers and non-smokers population by ultrasound. This was a quantitative, descriptive, and correlational study. The sample, it was measured 103 volunteers participants, 52 non-smokers and 51 smokers, aged between 20 and 40 years old. The inclusion criteria was healthy participants with unknown diseases. The smokers group was divided into 4 different categories depending on the average number of cigarettes smoked per day. The first category, 1 to 4 cigarettes per day. Second category, 5 to 9 cigarettes per day. The third category, 10 to 14 cigarettes per day. And the last category, more than 15 cigarettes per day. The independent variables was the average number of cigarettes smoked by day and the gender, and the dependent variables was the intima-media thickness, the peak systolic velocity, and the end-diastolic velocity. As protocol, we utilize a portable ultrasound equipment with a linear transducer of 7.5 megahertz. With the B-mode, we made a longitudinal and transverse section of the left common carotid artery, 1.5 centimeters below the carotid bulb. We also measured the PSV and EDV by pulse Doppler. As results, we can see here that the EMT on the non-smoker population was 0.512, and in the smoker population, 0.706. Here is the results on the PSV and the EDV, where we can see that the smoker populations got more hemodynamic values. Here is a table that resumes the structural and hemodynamic changes depending on the average number of cigarettes smoked per day. Here is the control group, the non-smokers, and as we can see, the EMT, PSV, and EDV values rose as the number of cigarettes smoked per day is higher. Here we can see the EMT depending on the gender in the control group and the smokers group, where we can see that the male smokers got a EMT of 0.652 and the female smokers got 0.768. Here the PSV, where we can see that the male smokers got a higher value of 103.91 and the female smokers got a PSV of 105.92. Here the EDV, and one more time, the male smokers got a higher value of 28.23, and the female smokers got 32.1. Similar results of the EMT and PSV were reported by previous studies. However, these authors described EDV values inversely proportional to the number of cigarettes smoked per day. As conclusion, the data from this study suggests that smoking has negative effects on carotid artery structures and hemodynamics. Therefore, smoking is a risk factor for alterations in carotid arteries, haemodynamics, and female smokers are more likely to develop vascular changes. In a preventive perspective, trained radiographers can play a key role in the assessment of pathological changes. This is the reference. Thank you to all for your attention.